DB09. DB09, it's trying to move a very useful, I think it's the most important drug in the journey of a patient with HER2 positive metastatic breast cancer, trastuzumab deruxtecan, moving it to the front line. The DB09 was that study. Can you give us an overview of that study?
Sure. So this was a randomized phase 3 trial looking, again, like you said, in the first line setting, and is a 3-arm randomization. So patients were randomized to the CLEOPATRA regimen, the THP, or trastuzumab deruxtecan with pertuzumab, or trastuzumab deruxtecan with placebo. And so we don't yet have the results of the trastuzumab deruxtecan placebo arm because that median follow-up has not yet been reached. So really what we're talking about when the results and the publication that we've seen is comparing THP to the T-DXd plus P arm. These patients had not previously been treated. They could have been allowed to have 1 line of endocrine therapy. So it's important to keep that in mind that this is really a first-line trial. So it's really moving it up in the patient's treatment journey.
No, for sure, for sure. I mean, the results speaks for themselves. I mean, before they showed us the result, we were doing some bets between us. What do we expect the median PFS to be? And we were all, I would say, like astonished to see a median PFS that was above 40 months. Dr. Pegram, what do you have to say to that?
Oh, the study met its primary endpoint with flying colors. Hazard ratio of 0.56. P-value exceeded the O'Brien-Fleming target p-value with 4 zeros after the decimal point. And so just very robust statistics. The Kaplan-Meier curves separate early within the first few months of follow-up, and they stay apart, pretty much till the end of time. At the median, there's a 13.8-month delta in median PFS. So once again, with this molecule, the single most active HER2 targeting agent, T-DXd, we see very robust efficacy signal here in the first line. And so this is unprecedented in as much as it replaces the old standard of care, which has been around for so long.
Yeah, I think one of the things that was really exciting for me is looking at the complete clinical responses. The complete clinical responses were in the upward of 15%. Dr. Rao, what is the significance of that, in your opinion?
I think it's remarkable to see complete responses in these patients who have metastatic disease. But I think, even though we see a few of them with the CLEOPATRA regimen, this was almost double what we saw compared to THP. So it's really nice to see that patients are having such a great response. Other endpoints were also prolonged, the duration of response, the overall response rate, including complete and partial responses. So it was really nice to see that a number of the secondary endpoints were met as well.
Yeah, I mean,
the overall,
go ahead, Dr.
The overall response rate was 85.1%.
85.
I mean, we've just never seen anything like this.
We've never seen that. Yep.
Extraordinary.
It
I mean,
is,
the control arm performed well too in this trial, I have to admit. It was like 78.5% objective response rate for the THP arm, but still 85% is unprecedented, and it's the most active regimen I've ever seen in HER2 positive metastatic disease.